Hello, everyone. Thank you for coming. I am Ray Blaylark, and I am the founder and the president of Sickle Cell Foundation of Minnesota. And I am so excited about tonight's session of Living SickleSMART. There's still a few more people that are coming in, but we're going to get started. Before we actually get started, I just want to make sure that I say thank you to our partners and sponsors, Beam Therapeutics, Agios, Be the Match, Children's, and the Sickle Cell Disease Data Collection Project out of the CDC, or the Center for Disease Control. Tonight's session I'm so excited, is the East meets the West, and we are joined by Biba Tinga, who is the president of Sickle Cell Disease Association of Canada. And this is going to be such a good show. I'm going to stop sharing so that you can see us. Now, let me just tell y'all, we do this live. So things happen while it's live, but that's okay. We keep it moving. Now, you should also know that this is interactive. So we want you to ask your questions. We want you to comment. So if you want to comment or ask questions, comments go in the chat. And then we ask that you use the Q&A button at the bottom to ask your questions. You can ask anytime during the presentation, and we'll be answering them as we go. But please, 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 we want to hear your comments. We want to hear your questions. So don't be shy. When you put the questions in Q&A, then we can see them and they don't get lost in the chat, which has happened before. So, but without further ado, I want to introduce to you Miss Biba Tinga, my friend and colleague in the Sickle Cell Advocacy. But Biba Tinga is the mother of a young adult living with sickle cell disease. And as a caregiver, she has a unique understanding of the needs of the children and families dealing with sickle cell. She brings a wealth of experience and a lifelong dedication to improving conditions for those living with sickle cell disease. She is currently the president of Sickle Cell Disease Association of Canada, also known as SCDAC. It is the Canadian national umbrella for sickle cell disease organizations. She also sits on the board of GASGO, the Global Alliance of Sickle Cell Disease Organization, where she leads the fundraising and membership committees. She's been named Advocate of the Year in 2021, and she is pursuing a lifelong dedication to improving conditions for people living with sickle cell disease and for their families in Canada and globally. She's a working mother of 4. I don't know where she gets all the energy she has. I don't. And she's a tireless advocate for the Black community. I am so proud to call this woman my friend. So without further ado, I'm going to bring Miss Biba Tinga on and allow her to say a few more things about herself and what she does, and then we'll get started with the presentation.
Thank you so much for this great intro, Ray. It's an honor to be here. It's an honor to be your guest today in Minnesota. Good evening, everyone. Happy month, happy Sickle Cell Awareness Month, because today is September 1st, and September is Sickle Cell Awareness Month. So, as you've said, I'm joining you today from Montreal, Canada, the French-speaking side of Canada. It's going to be an interactive discussion, as you've said. I am going to share a PowerPoint. I'm going to talk about my journey, our journey, I would like to say, I as a family. And then after that, you and I are going to have a discussion about what we've been going through, living the same life, in different worlds.
That's right.
And I hope here today, our guests are going to be able to join us, and participate in this discussion and share if you've experienced the same thing or something different. This in no means that what we are doing or what we've done is the way to do it, because we are just learning every single day.
Every day.
Every day we're learning. So, yeah.
I will start the presentation, and then we are going to have a discussion.
Yep.
Okay, while you're doing your presentation, I'm going to be on mute and turn my camera off. So you've got it.
Thank you. So I will let you know when I need to move to the next slide. So welcome everyone. East meet West. How did this warrior mom conversation come about? It's because Ray and I were having a conversation as warrior moms, both of us, and we realized that even though we lived in different continents, different world, we went through the same journey. And it was important for us to bring it together today so that you can see that wherever you live, the challenges, the struggle, and everything we go through is the same. Next, please, next slide. Now, sickle cell disease is a multi-system disease. I'm sure I don't have to tell anyone here around the table what sickle cell disease is. We know, but it was important that before we start, I tell you, and you look at this picture and see how sickle cell disease affects people. It affects your entire body, and it can affect you anywhere from head to toe, inside, outside, everywhere, every single organ of your body can be affected by sickle cell. So next, every sickle cell journey begins with a story. And here is our story. It started in May 1988 in sub-Saharan Africa, West Africa, in Niger. I always like to say that Niger is one of the countries at the door of the Sahara Desert. It's one of the hottest places in the world, I think. Yes, it is. It's really hot. So that's where I was born and raised, and that's where my son was born too, in May 1998. On the left, you see that picture. I was holding him. I think he was about 3 months in the picture, but I didn't know that he had sickle cell. I was a very young mom. I just turned 19 when my son was born. I had almost no knowledge about this disease. I didn't know much about sickle cell. And here I was becoming a young mom, and I was so thrilled to have this young, and I had so many dreams, big dreams for both of us, because I was just getting into college and I was looking forward to building a huge future for us. And I was just looking at this boy, I'm like, I'm gonna make him so happy and I'm gonna work. I was training to become a teacher at the time. So life was good, life was beautiful. Until the next slide, please. We got the diagnosis of sickle cell disease. And it happened when he was around 7 months old. As any child, he got sick, started with fever. He wasn't eating, he was crying a lot. And then we took him to the clinic, to the neighborhood clinic. The first thing they said was, oh, malaria. Because we have a lot of malaria cases. When a child, without any test, they just said, oh, it's malaria, don't worry, with the symptom that you are giving us. They sent us back home with a treatment. And we went home for a week treating malaria. But as the week progressed, then he kept showing again more signs, of discomfort, crying, and really that fever wasn't going away. So we took him back. And that's when that pediatrician in that little neighborhood clinic said, I think this is not malaria, it's something else. I'm gonna have to send you to the hospital. So we got transferred to the hospital. And from there, the doctor, the pediatrician that was at the hospital, at first look said, I think I know what this child has, but I'm going to run some tests. So it took about three weeks to a month before we got the diagnosis. And to me, that's really a lot. Because remember, there was no newborn screening at that time. And that's how I got to the sickle cell diagnosis. And it was in 1988. And when you receive a diagnosis, it was not about them telling you, oh, your child has sickle cell. This is a referral for you to go to the next appointment and meet. No, it was a death sentence that was handed to you. You see it in the eyes of the healthcare providers. You see it in the eyes of your family members, people around you. Everybody looks at you, with this look of sadness and just telling you that, okay. And most people around me at that time were pretty clear that you go home, you raise that child, you love that child until what everybody thinks is going to happen. And what does happen to children under the age of 5 is that they die at a very young age in sub-Saharan Africa. So that's what I was facing. Next. So when we got that diagnosis in 1988, there was no internet. I had no medical background. There was no clear, understandable explanation from the physician, because they just tell you, okay, this child has sickle cell, so this is the clinic where we are going to take care of your child. You have to come once a week. If he's sick, if he has fever or he's crying, or maybe you see anything that you don't understand, just bring him here. That's all they tell you. And the medicalized jargon that they use, you are not able to comprehend it, even if you are educated. And I was educated. I was a young college student. Here on the right here, it's the exact writing of the physician that you see. After the diagnosis, the first consultation when we went, he asked me to bring a school notebook. And I was wondering, why is he asking me to bring a notebook? The reason why is because he knew that he will have so many things to write, because there was, that they don't use computers. So it's just everything was handwritten at the time, that they were going to use that handbook to record everything, every treatment, every crisis, everything. And we still have it to this day. I still have exactly the first transfusion, every crisis that we went to the hospital, every hospital stay had been, recorded. So it's in French, but you can read the date was April 4th, 1989. He was about 1 year old. And on the left here, it says F33.7, S62.9, and A23.4%. So the only thing I understood at that time, what he told me, he said, you see, the S is the bad hemoglobin. The F is the fetal one, but don't worry, it will change. And the way I see it, it might change to become an S, because by the time he was 1, maybe we've been to the hospital 3 times already, or yes, 3 times, and he already had 1 surgery. So he said, I don't think this is going to turn into an A and make it a mild form of sickle cell for him. And then he said, we need to know his blood type. And that's the first thing they wrote there. I was wondering why, because our reality was going to be unpredictable crisis. And then we get to the hospital, hydration, painkillers, they were just limited to codeine. And then at the end, they would say, well, we need to give him some blood. And we go back home and we wait till the next crisis. Weeks after weeks, month after month, and we continue to survive that way. And that very moment, I understood something, is that I needed to understand exactly what they were doing to that child. I needed to learn to be able to follow what the physician was telling me. Him handing me just a prescription and telling me, you go home, you give him this medication, he has an infection, or he has pain here, or hydrate him and come back in a week, wasn't enough for me. But if there were no patient group, if there was no internet, there was nowhere for me to turn to get the information, how do you think I can educate myself to take care of that child? Well, I was lucky. I had some friends who were in med school. Believe it or not, they were in their first and second year. They were my first go-to people. I went to them and I read all their notes. I remember I used to tell them, can you please write very well so that I can read? I was reading everything, every chapter they've had about sickle cell. I read it. I was going to school with them, and everything they knew, I was asking them, explain to me. So what's going to happen to him? But they will tell me, okay, if he has a crisis, if they tell you that you have to give him all the immunization, do it. And if there is the malaria season, make sure that he doesn't get malaria. But at the end, they will tell you, but Biba, you know what? If you are lucky, maybe he will reach age 15, but not more than that. So we had the treatment we had when there was a huge crisis was just blood transfusion and nothing else. There was no hydroxyurea at the time. That's how I raised that child from the first years of his life. Next. Now, as we were living that life, so many challenges. The first one was that I noticed that very often, again, on the right, you see, it's the writing of the pediatrician. He will frequently ask me to go and take this blood test. And because they hand it to you, they gave you, and they say, you go take the test and you bring back the result. So I had access to all the documents. So he would give it to me, and you can see the date here. This was in 1992. And he will write, this is French, serology complex. If I translate it in English, it will be complex serology. And I had to go to my friend and ask them, what does this mean? That's when they explained to me, oh, this is worse than sickle cell. This is a disease called AIDS, and that's what he's testing. And I'm like, but why will he test this on this child? He goes, well, that means your child might get it through the blood that he's receiving, because the blood we're giving him, we don't know, the blood can be contaminated. So I just realized that, and they told me that AIDS was worse than sickle cell, because if he gets this, he will die for sure. So I asked them, so what can I do? Because you are telling me that the only treatment option we had was the blood transfusion. And then you're telling me that if I continue to let them give him blood, he might die. So what do I have to do? They said, well, you go talk to the doctor and maybe he will find a way, or you tell them that you will only want him to be transfused if there are no other options. So from 1992 to the time we left, to the time he left Africa to come to Canada, that's how we treated him. I would tell them, is there anything we can do? And that poor child went through a lot. Every single food that they would tell me, can help him increase his hemoglobin, I would give it to him. I would say, you have to drink, you have to eat, you have to rest, no sport. He couldn't play basketball, he couldn't do anything, just sit, he was so sheltered because I didn't want him to get sick, because I didn't want them to give him the blood. So we had that reality, limited blood, limited treatment option, and then the social stigma. How do you take care of a child in an environment where people are even hiding that they have sickle cell? You couldn't even have another mother come and talk to you and said, we are living the same reality. What Ray and I are doing today, I didn't have a chance to have a conversation with another mother at that time. Even when we met at the hospital, everybody was pretending that everything was there, but not sickle cell. The kids will play, we will talk about everything, but we are not discussing our own realities. So I couldn't learn from them, even if the kids were older than mine. And there were no support group to go to. The way you have programs offered to you, like this session today, where we're gonna have this conversation and talk about what we've been through and what works for all the solution, there was not anything like that available. And I had no resources. As I told you, I was a young mom, I was a young student, and sickle cell is expensive. At the time, I remember that the physician was just worried about treating the child. And when you go, he said, well, immunization. We live in a country where there was so many infections a child can get at a very young age that every single immunization available had to be given to them. And you had to buy them out of pocket. There was no healthcare system, there was no insurance for me to cover that. So I had to find the money to pay for all that. And in that very moment, I can say I had so many broken dreams. All those beautiful dreams that I had, of me living and becoming a teacher and raising that child and being happy, it all went down. One of the first things that, one of the first feeling that I lived with was fear. And I do not like that feeling. That's why I refuse to be scared now. I refuse to be scared in any given situation, because it limits the way you see life. It limits your ability to even be productive, proactive in your life. But what could I do? Everybody around me was telling me that there was no hope. So what can I do? But I continued to live. I think one of the things that helped us was my young age. As I was looking at the adult world, I found them very pessimistic. And I was like, I don't know why they don't believe that this child will live, And in a way, I love that child, and I decided to do everything I could. And by doing that, I didn't know that then, but now I do. I know it. I never missed any doctor's appointment. I was showing up, doing exactly what the doctors was telling me. And that's how I became one of the most dedicated and disciplined mother. And now in the jargon, when I talk to my son, we talk about it, we said that treatment adherence, because I taught him to just do exactly what the physician said. At a very young age, you have to take your acid folic. We have to go every Wednesday. Either you were sick or not, even if I have to miss my afternoon class, we will be there. Sometimes I remember I would have midterm exams, but he was in the hospital. I would go there, spend the night, and then go to school, take my exam and come back. Because for me, school was important, but his care also was as important as that. So we wouldn't miss none of them. Next, please. So I talked about fear. I had to master that fear if I wanted to raise that child. And one of the first thing, of course, love. Love for myself, self-care. I really had to continue to find a way to love myself when you are raising a child out of fear, out of guilt, out of, also frustration and sadness. And so I had to continue to say, I love myself, I'm a mom, I have to do something for the child. And then I love that child. No matter what people will try to tell me, no matter what I saw the reality of him going through a crisis, being so skinny, so small, I still will not give up on making sure that he had the best treatment, he had everything he needed to be as a normal child. So I sent him to school, I let him play, maybe not go play football with kids, but whatever he can do, I let him do it. And then you educate yourself. As I told you, I was reading the notes. I was reading every book I could find, and I was listening to the doctor carefully. I believe I started journaling at that time because I was writing. To this day, I can tell you the first date of his transfusion. I can tell you the first surgery he had, who was the physician. I kept all the documents. We have archives that are so huge, that we can go back 34 years, because yes, my son is 34 years today. And you have to be strong to ask the right question. The day I stood in front of that physician and to tell him that I didn't want the transfusion, I think that was the most courageous act I've done in my life at that stage. Because let me explain to you the reality at that time. As I like to say, at that time, and even sometimes now, I believe in Africa, you have God, you have the doctors, and then you have everybody else here. We don't question the doctor. Like, we like to joke about it, and we say that the physician, the doctor, is the only person who can change what God has done. Because if you're sick, sometimes he can save your life. So we joke about it, but it's a way to say that how we respect their work. So for me to go back and tell him that what he's doing, I don't want him to do it. The older parents were looking at me like, is she out of her mind? She doesn't want the blood, and she's telling the doctor, what is he gonna do? But here is what that did. He just said to me, oh, okay, I don't like transfusion too, because you know what? If we continue to give him blood, it's going to create a problem more serious, even that is even very painful and even as bad as the AIDS that you are scared of. Again, the medicalized jargon, what he should have told me is that there is something called iron overload that can happen. But he didn't say that. So I was again afraid. So there is something else. There is sickle cell. There is this possibility of him catching AIDS. And then the doctor is telling me that there is something worse that can be, again, worse than what he's doing. So you have to be strong. Ask the question. If they give you a treatment, if you don't know what it means, if you cannot find information about it, ask them, why am I getting this treatment? How is it going to affect me on the long term? What are the side effects? I had the courage to do that. And then you have to consult, partner with medical champions. And that's what I did with my friends. I would like to tell you something, that one of the people that I was going to read their notes, today he's a physician, and he's working for GBT in Europe. And another one is and became, I believe, a cardiologist in France. So all of them are physicians today. And when we see each other, we talk about that time where he said, oh my God, Biba, you were a problem. We had to bring all our notes to your house for you to read. It's like you are a second student with us. And then early advocacy. I started, but I didn't know it was being an advocate. I was just being a mom. Remember when I told you about the blood? When my son was about a year, the head nurse called me and she said, you know what we think, because sickle cell is going to manifest itself in different ways. Some have frequent crises, some do not, but they will have a major crisis every 2 months or once a year. And then she said the complications are different. She said, well, your son is going to have sickle cell anemia. He's going to need blood for the rest of his life. She said, but here is the problem. We do not have blood all the time. And because sickle cell is unpredictable, we need you to work with us. So at the hospital, they had this program that you have to go in the community, in your family, and recruit the blood donors yourself. And then they come, regardless what the blood type is, they will donate blood to the blood bank. And in exchange, the hospital will make sure that if your child needs blood, in the event, they will always keep the equivalent of the blood donated by the people you've recruited. Different countries, different systems. You see now here, we walk to the hospital. We don't have to worry about if blood is there and if we have the right one. They will find it for us because we have the blood operators working with the hospital and patient group, because we are also advocates for blood donation in the communities, right? But it was different then. So at that time, when I was going and convincing all my young friends and telling them, come and donate blood, I thought I was just working to help them treat my child. And when I came to North America, I realized that here, even the patient group are also, the patient advocates are working to do the same thing. So be disciplined, do not miss appointment, set priorities. I had to set priorities at that time. Had to sit and say, this is important, this is not important. Like every Wednesday afternoon, as I said, we were at the hospital, no matter what happened. And if I have to miss the party of the year, if I have to miss the family event, it doesn't matter. That child's health was important, and I had to do what I had to do to keep him healthy and alive. Next, please. With all that, he grew up with challenges, with everything. And I love this picture, because this picture is way when we came to Canada, and I think it was about 3 or 5 years after we were standing in Ottawa, we went to advocate for Canada to recognize June 19 as Sickle Cell Awareness Day. The reason why I love this picture is because it represents everything we've worked for all these years. Because that child was not growing when we came to Canada. He had a growth delay, 3 years. And then he was always in constant pain. And every time he cried, every single time that boy cried, when I saw tears in his eyes because he was in pain, I will cry too. And if my sisters or my family members were around me, some of them will cry. So we cried so much. And we cried because sometimes we thought he wasn't going to make it. And what North America changed for us is that boy stopped crying, because there was better pain management protocol here. So I thought it was a big life change. After the pain management, what happened is that he went on to the blood transfusion program and he grew up. So I was holding him now. He was so small when we came in. Now he was even, almost taller than me. And then after the blood transfusion program, then they put him on hydroxyurea. He went on for almost 2 or 3 years without any major crisis. And he went to graduate from college and got a life. His quality of life improved. And when that happened, I was able to stand as a mom and as a woman and breathe and look around me, enjoy life a little bit more, and take care of the younger sibling more, because they missed out on so much, because we tend to forget about those warriors who are growing up with siblings who have sickle cell. It takes so much time and energy that sometimes you only focus on what is essential, and all the rest you have to tell them, we can't go out today, we can't just go to the park every day because I'm just tired, I'm just busy. I was running between the hospital and the home sometimes. So hope, after all those broken dreams, that's what the difference in the treatment prop in our life. Hope. Next. Now, with that hope came all the challenges. Here is my son here, you see him. He hates this picture, and I love to share the picture, I don't know why. So let's talk about the treatment option that were offered here. As I said, he stopped crying, less pain, a better pain management protocol. But at that time, I didn't know that there was something attached with that. The price to pay was huge. And that's when my eyes opened now to the reality of the West. They will use opioid to treat our kids because of the pain. And then at the end, they will tell us that, oh, he's addicted to the opioids. I don't agree with that. I think the sickle cell has to be treated with opioids. So if you put somebody on a treatment that creates this addiction, the addiction is not on him. He's not addicted to the medication. He's addicted to the treatment that you've been giving him. I see no fault on his part here. He's just fighting to survive. So when I look at it in Canada, at the time when we come here, and I start now looking at the reality and comparing both worlds, and I realized that even in Canada, we had over 40 years without targeted treatment for sickle cell. They had the blood transfusion and they had hydroxyurea. That's it. And those are not specifically made for sickle cell. Somebody with leukemia will receive blood transfusion, and hydroxyurea was a cancer drug that they were using for sickle cell patients. Then I realized that I was still in the same situation, different setting, but same thing. So the sickle cell, people who were affected by sickle cell, even in North America, they are struggling too. And after my son went through all these treatments, at some point the hydroxyurea stopped working. So they tell us we don't have any other option. Even the only thing left for him now is to be on the blood exchange apheresis program. And that's where he's been now for the past almost 10 years. But there is a burden with the treatment, the frequency of the visit every 9 weeks for him, and the number of blood bags that he will receive vary between 7 and 10 every time he goes. And actually on this picture, he's receiving his treatment. And that treatment he's receiving, it's supportive care, because it doesn't treat the disease. You know, they gave him painkillers, antibiotics, and blood transfusion. So I sat and I said, but that's the same thing we've been getting in Africa. There's no difference. So what's the difference now? It's not a cure. So we've been here for the past 17 years, and we're still here. I'm still scared of the iron overload. Remember when that African pediatrician said that there is something worse that he doesn't like? We went through that. He's been taking a medication to try and lower it. He's been getting reaction because sometimes of the blood. So that's why I advocate for more donors from the Black community. We work with the community to tell people you have to donate blood. But a new era of hope arises now. You know, we have new treatment specifically dedicated for sickle cell disease. And we hear that there are so many curative therapies in the pipeline, but we don't have them in Canada. You have them in the United States, but they are not available for everyone, right? So that's why we have to work as a community. Next. Sickle cell in the world. So as I told you, because I lived in Africa, to come here in North America and living and still going back very often to Africa and working with people like Ray, you know, in other advocates in America and all over the world, I have a clearer picture of what the reality of sickle cell is in the world. It's a global public health problem. Every year we have 300,000 babies born with sickle cell disease. So they're telling us that, you know, it will rise by 30% in 2050 to 30% in 2050. 5% of the world's population are sickle cell trait carriers. That means we're going to continue to pass on those genes. And the mortality rate is high. I just came back from a vacation from Niger. Every time I go back to Niger, and I always visit the clinic, I'm very close with all the physicians and the community there. I work closely with them. But every trip we have to mourn the loss of a warrior, and very young, 2, 5, 7. The last one was 22. So what can we do? What can we do as a community? What should we do? What must we do? Next, please. As a community, we have to come together. We have a national group like the one who put together this wonderful event in Minnesota, working to support you and to guide you and working for you and with you. So we have to support them. We have to work with them, because it's about equity. We are not seeking equity. We deserve equity. Health equity is something that we deserve as any other human being. But how come our community has been left out for so long? With supportive care, issues with access to care, the stigma, no newborn screening in some countries, the research agenda, nobody wants to really look at it, and the lack of education and awareness, even amongst people who are treating us, the healthcare providers themselves. I really invite you to go and look at the SHAPE survey that GBT just released. You're going to have some data there that is going to blow your mind. But to the healthcare providers, even at saying, not even the fact that they don't have the resources to treat our patients, but also the fact that sometimes they do not know how to do it. So sickle cell disease has been discovered since 1910. I can't understand that. To this day, we are still here asking for just more treatment option, more research, newborn screening, some basic things that have been done for disease that were discovered way after sickle cell disease. This is a social injustice. And yet, when we talk about the opioid issue in the sickle cell community, I just point the finger to say, look at the opioid crisis that is the whole world. How many of them are sickle cell patients? Less than 1%. So why is the focus on our community? Why do we have also to move from one place to another to seek care? Because you know what? For my family, I have to tell that our immigration project was not really linked to my son's health. It was a family project, but at the same time, it helped him be alive, because I don't think he would have been around if we had stayed in Niger. So for their quality of life, I am close to so many young adults here in Canada in the work that we do. And I know that those who are 35 and over, they struggle to maintain an active life, a social life, a career. So where is the quality of life when you have to rely on people, on the system to support you? And yet they love to say, oh, people are living longer. And I always add to say, but have you asked the patients and the caregivers about the quality of life? So we need to support those national groups who are working for us, because I realized something, why I became a patient advocate. I didn't just stop being the warrior mom that I was, because when I came to Canada, I realized, I said, okay, I can stay home. I can make sure that he eats and I shelter him. I take care of him. If he can't work, I will support him. But then because the system, our healthcare system is public, then we need to change the policies so that he can have access to a better care. So you can't sit just and take care of yourself. You have to be part of this community and work and collaborate. So to move faster and effectively, we have to identify together the issues that affect us all, and we have to work together to fix them. We do, I can see we don't have newborn screening in Canada. We do have newborn screening, but we have 2 provinces now that are not screening, but they only start screening when we start advocating for it in Canada. So next, please. Collaboration is essential. There is no other way to do it. We educate the world to break the stigma and avoid the prison cages. For us to do that, we have to create global standards of care so that wherever you go, wherever you travel, wherever you want to go, wherever life takes you, if you have sickle cell, you don't have to stay in here, because my physician, the physician who knows sickle cell is here. The hospital where I can receive the best care is here. So I can't move, even if I have this job opportunity. I can't move, even if the love of my life is in another state. I can move and follow my family because they decide to move, because I have the best care here. That's the most unfair thing that I've seen sickle cell patients go through. We have to work as one. Now, for us to get to that, we have to change our mindset as a community. And I would like to share one example with you. Every time we talk about environment, you see, I drink water, tap water, I have my bottle, I fill it because I have to hydrate, I have sickle cell trait, but at the same time, environment conscious, right? Those bottles that you buy and you throw them, you have. So I grew up in Africa. And I know that in Africa, we still have to cut trees, to be able to build and develop the way the Western world has done it. But here, when I live in my reality, I recycle, I even compost. There are a lot of things that you do because of the environment. But you know why we do it? Because we were educated, the whole community, to think and act like that. And because somebody, Greenpeace behind that, has the idea to have one single issue and get the whole world to rally behind that cause, has won. And that's what we've not been able to do for sickle cell disease. If we all stand, September is Sickle Cell Awareness Month, every single patient support group has the support of the community around them. And they come and they stand. And then they say, For this month, we ask our policymakers, we ask our country, we ask our politicians, we ask that they put newborn screening so that we're going to prevent early death, and then we're going to start early diagnosis and treatment for every single child born with sickle cell disease. And we have the same thing, and we continue to work on that. It's going to happen, because democracy is about number, and we got the number, but we don't have the community together as one. That's why we're struggling. Next, please. We have to make the sickle cell a conversation in every single mom, so that we can make the world sickle cell friendly. This picture is with a young boy from Ottawa. His name is Micah. I met him because we went to the Senate of Canada to talk to the politicians, to the policymakers. And I wanted to bring a young child for them to look at him and say, when he's like this, everybody loves him. Everybody wanted to talk to him and to see how he's in pain, if he's getting the care he needs. But in a few years, when that same Micah is going to grow up and become a man, then everybody is scared of him because he had an opioid issue, because he's addicted to the medication that they've been giving him. So that's what I wanted to change. I said, look at him. And I went with my son, who was standing as an adult with his beard and everything. And I said, Micah is going to become him. And he was Micah once. And we have to work for them and make sure that whatever the age is, whatever they look like, they need to get the treatment. So thank you all for your time. And I hope that I'm going to hear from you, from what you think and all your questions, and we're going to have a conversation about this topic.
Wow, I know that, like, I'm here to talk to you, but every time we talk about our journey, I see so much similarity, and just especially the emotional burden. You know, you all were born into a region that we know that we have more resources and we have more access here, particularly in the United States. I don't think people know that even in Canada, many of the options that are available to us here in the United States are not available there. You said so many things. I know that there's a couple of people, because of the time difference, who may have to leave. And so I just want to recognize all of you from all over the world. Some of you are up 1 a.m., I think I saw there. So thank you so much for attending this session. It will be available in full tomorrow, probably around tomorrow morning for us. That's about 12 hours from now. And you'll be able to watch it on demand through our YouTube channel. I put the link in the chat, so it is there. I will put it again at the end. But now is a perfect time. You all ask your questions. We want to hear them. I see some questions already in the chat. For those who may have put their questions in the chat, the reason we want you to use the Q&A is because they get lost as people continue to type, and we can't always find them, and I don't want to skip anybody's questions. So there's a lot of questions of what can be done to better advocate as a parent. And I remember this journey. You said a couple things that I was like, yep. And one of those was the internet wasn't available when our kids. So for those who don't know, my son, I too am a warrior mom. My son is 26 years old. So there's a few years difference, but there's a big difference from some of the science discoveries and some of the knowledge that has occurred even between those years of your son and even my son. But even then, after that, having the internet, the World Wide Web, open so much. We were so limited. We didn't have that. So we are grateful for where we are now. But we also know that none of us signed up for this. Like, there's no other way to say that. We didn't sign up for this. We did not know. Now we embrace it because they're our children. We love them and we want the best life for them. Yeah. You said something else that struck home, and I say it all the time, that death of a dream, that mourning process that happens right after that diagnosis.
Yeah.
because you spent 9 months, imagining what life was going to be like with your new child, imagining all of the dreams you had for them and the dreams they would have for themselves.
Yeah.
And then the realization that some of those things may not happen, but we're moving along where more dreams are coming true. But the reality is that it's a tough life.
Yeah.
And it comes with challenges. So let's talk.
Let's talk. Oh.
What tips can you give? I see a question. What tips can you give new parents on how to advocate for their kids?
What tips? Well, one of the first things, as I said, educate yourself. You have to know. If you are not even able to understand what are your child vitals, when you get to the ER, for example, how can you help that child? So educate yourself, know everything, and be organized. For example, in Quebec, when I start working with the patient group, one of the things that we did, we had to buy thermometers and give it to the nurse and say, for every new diagnosis, we offer it to the mom. When they come to the ER and they ask how high is the fever, the temperature, but they don't know. Oh, he was very hot. You need to know, because that's essential with sickle cell. You need to be able to have a chart and say, oh, I'm hydrating, it's not going down, I have to take you to the hospital right away. So what tip I can give you is educate yourself, be organized, and most importantly, allyship. Find your champions. You might not get along with all the nurses and all the physicians, but some of them really, you have to work with them to care for your child. So find your medical champions and work with them. Those who want to work with you, make sure that you have to start.
I agree. I mean, educating yourself, that was my number one worry as a new parent of a child with sickle cell disease. I was concerned because I was like, how am I going to help a child with a disease I don't even understand? I don't know anything about. I knew that I had sickle cell trait, but I found out in high school and I didn't ask questions. I didn't know what that meant. I didn't understand what a trait even was during some of those years, let alone what it meant to have the disease or my risk factors, right? Because those who live with the trait, and you said it, 5% of the country has sickle cell trait. And yet a vast majority of them likely don't understand that they are in the highest risk category for having a child with sickle cell disease. One, if you and your partner have sickle cell trait, that's a 1 in 4 chance with every pregnancy. Not you have 4 kids and maybe 1, because I've met individuals that have 3 kids and all 3 have sickle cell disease. So it's a risk each time. This
is what maybe as caregiver we have to talk about. I always tell parents when I meet young adults, I said, do not play the genetic lottery, because that's what they do, right? They said, okay, maybe I will try the next one. I won't have a child with sickle cell, then I will. But you cannot predict. It can happen with every pregnancy, or you can have just one. So that's why we need the people to be educated, so that if you get tested before, when it comes time to have kids, and you make a decision, a conscious decision, not to pass on the genes. And there is no other way in our community for us to change things if we don't have that conversation. Our children were born with sickle cell. In my personal case, I was young, I didn't know, but then I chose to marry somebody else so that my other kids will not have sickle cell. And I do have one child with sickle cell trait now. So I talk to him all the time. From the beginning, we found out when he was maybe 4 years old. And I told him, I said, you cannot just see somebody and say you're in love and you're gonna just get married and have kids. You need to ask the questions, especially if she is from a community where she might be a carrier. So we need to have the conversation. We need to be honest. We can't sit and say, oh, I didn't know I have the trait. I never got tested, but my mom said I don't have sickle cell. We don't have it in our family. And then when we have the child, then we sit again and we are victims of the system all the time, generation after generation. But we don't change nothing in our own, the way we do things. And we continue. When you look at those staggering numbers, 30% of the babies are going to be born with sickle cell. That means we are not changing anything.
Yes.
It does not make sense because
Yes.
sickle cell is painful. It's a debilitating disease. Who wants to have a child who is suffering all their life? Like sometimes you sit and you say, if I can take that pain away from you, I will just take the sickle cell. But you can't do that for your child, even if you love the child. So,
and that's one of the pains of being a caregiver, is watching your child suffer and not, we are fixers by nature. We just want to fix it all, and we want to make sure everything's okay. And to be in a situation time after time after time where you can't do that.
Yeah.
I just want to add one more answer to Ulysses' question. And hi, Ulysses, it's good to see you. One of the things about advocating for your child, being there for your child, is also connecting with the community. And that's one of the things that we want to shout from the rooftops, right? Mm-hmm. None of us can do this alone. None of us. And because, when we had our children, there wasn't this global network, and you had to go back to community. Here in Minnesota, I couldn't find anyone who was talking about it or who knew about it. Yeah. Right. And in fact, that's how my advocacy began, because I said, if I can't find anyone to talk to, there's got to be other people who are in the same situation, and we need to find each other. But I also need to make sure that people understand sickle cell trait, because I didn't, and so that they can make an informed decision. Of course, we're not here to tell people what to do, but we do want you to be thoughtful. We do want you to understand the risk factors, and we want you to understand that taking that risk and then having a child, what that could look like for you. Now, obviously, we're talking to people, most people on in this session, who are already affected by sickle cell disease. And so we certainly, understand that journey, whether you're living with it or you're a caregiver. It's a part of your life. If you're a sibling of a person with sickle cell disease, it's part of your life. It changes the family dynamics. Your normal, changes. You have to adopt a new normal. So one of the things I learned really early on is I can't compare me as a mother, as a parent, or even our family to another family who doesn't live with sickle cell disease, because it made me feel like I was doing something wrong. It made me feel like, but they also just didn't understand the challenges that we were met with. My son missed school, early on. He missed exorbitant amounts of school. He spent so much time in the hospital, he didn't even know how to talk to kids. He only knew how to talk to adults. And so his social development, his emotional development, finding a way to have healthy, age-appropriate conversations with your child who lives with sickle cell disease and their siblings, because it's important to bring them into the conversation so that they understand and they can develop the empathy for what's happening with their sibling, but also understand, and you said it, there might be times that we may not be able to go to this activity or that activity, because your brother or sister, we need to take care of them. So having those conversations early is huge.
It's huge, yeah. And you said it, when you were talking about community. When you have a patient support group like the one that you have in Minnesota, and we have SCDAC being different, we are the national umbrella, so we have provincial groups that are working provincially. I think it's really important about the parent who was asking what they can do. The first thing you do if you have a diagnosis, ask around to see, is there an organization for sickle cell disease, and join. Be a member, be an active member, show up when events are organized for you, for your kids. I used to bring the whole family. And you know what? I realized I've raised good helpers for my warriors, because they've been to conferences, they know the disease, they know what to expect on the long term, they understand how to care for their brother. Like so many things that we did when COVID happened, it was so beautiful how we were all sheltered here in the house. The first meeting we had was to decide, okay, if somebody has COVID, there's this room where we're going to isolate. And all of them were asking me, so what do we do with him? Because we can't keep him here. He has to go to the hospital. And then he was still working because he was an essential worker. And my other son, who doesn't have sickle cell, was home because all the colleges were closed. Every single day, went to pick up and drive his brother so that he wouldn't take public transportation. And because there was no vaccine at the time and he had to go to work. So he was just, and then he was able to drive and go out, pick up and bring him so that we can protect him. And I was doing the grocery shopping. So that is important, the family dynamic. But you get that because I took them to those sessions, I took them to those picnics, I took them to those walks, those fundraisers, and they've grown up now to become young adults who understand that mommy cannot do it herself. It's a family disease, as I say. Sickle cell affects the whole family because if he's well, we can carry on with our life. If he's not, we are all sad. So we might as well work together as a unit to keep him healthy so that everybody can go on and live on with their life. So it's important. So join your group, attend the event, support your group, because whatever your origin is, when I came at the beginning, I met some of my good friends like you through advocacy and attending events, conferences, right? So going to the SCDAC conference and sitting there and meeting all the parents, different world. Look at me coming from Africa and you, North America, and look how we sat there at the table and we went through the exact same challenges.
Yes, that's how we met. It was an SCDAA conference and we were sitting next to each other and we just started talking. And it was several years ago.
Exactly.
And who knew? I'm like, hey, when you said Canada, I'm like, you're my neighbor. I said, it makes sense for us to be working together.
Exactly.
And you said something that is so true because it's by joining that community that you find your village. Sickle cell disease is a very isolating disease, and so much of that is because of the stigma. It's because of the lack of education. I'll tell you, as a caregiver, I got tired of explaining to people who didn't know and what sickle cell was and I needed to explain why we couldn't do this or why we weren't doing that. Yeah. I'm not talking about the advocacy part. I love talking about sickle cell there, but to continually explain to family, to friends, to others that you may have an obligation to, that became exhausting. And so sometimes we withdraw so that we don't have to have those conversations, so that, we're not put in a position to be disappointed when we can't attend them. That was a huge piece for me. I had a very vibrant, I was a young adult. I was 24 when I had my son. So I had a social life. I was in college and all of those things. And it changed because the priority changed. And that was okay. You talked about that with your classes. If you had to miss a class, if you had to miss a big event, the priority changed. And the priority became learning about this disease, learning how to be an effective caregiver, but also recognizing that I needed to be present. I needed to be present so that my son would know that he had the support. He wasn't going through it alone. It was bad enough I couldn't take the pain away, but I'm going to be here with you in the pain. And that continues to this day. I am not a huge fan of the Americanized version of independence because it inadvertently advocates for that person doing it on their own. And I just don't think that that's healthy community. I think that we link arms.
Here is the thing. They could be more independent if they had the resources.
Absolutely.
So the reality is that they will say, oh, you shelter them too much. Oh, they are not independent. But guess what? The system is not built to support a sickle cell young adult for them to find a job. If they lose their job, disability claim, they're always denied most of the time in Canada, for instance, from our reality. So we are also working for them, for sickle cell to be recognized. So that's the other issue, because if you don't have the support from your government, so your family don't give it, what's going to happen to you? They are not going to have that long life that is being reported now for sickle cell adults. So that's why I think for me, we will, I like to say that I'm no longer a caregiver because my son lives
independently
on his own independently, but I'm a consultant now.
I literally just told my son that, I think it was yesterday.
I'm a consultant because guess what?
I'm a consultant in your care.
Yes, I'm a consultant in his care. So he sits, we have conversations, and sometimes I have my strategies when I want him to do something that I know he might not agree. So I think, like before, I think my son was about 25 when I left the consultation room, because him and the physician were just ignoring me. But I was going into every one of them, sitting there and, talking. And I can see that, he was like, if you can come, but you can't talk, But at some point I had to leave the room. And so he let me be because he wanted me to be. But now he will come willingly and tell me, this is what's going on. This is what they said we're doing. And this, what do you think? So I say, well, I went to this conference. I heard somebody say that. So I will share links with him. I will share information with him. And then we discuss together. And then if he needs help, he knows that I'm the first person he can call any time of the day. I will pick up my phone. I will be there. I will go to work. I will listen, and I will give any support I can give him. So that's how it's supposed to be.
And it is. And, there's a word for that called interdependence, right? You have dependence, you have codependent, which isn't healthy, right? Yeah. But this interdependence is a lost word in so much of society. And that's where the community comes together. It doesn't mean that person can't live independently. It doesn't mean they can't have a job, but it means that community shows up to support. And as caregivers, we hold a wealth of knowledge of all the years that they were growing up, right? Which still impacts what their care looks like now, because they have this journey to where they are. What works, what doesn't work, especially if your child is a young adult and just transitioning, out of pediatrics into adult, they need you. They need you. And it may not feel that way, because sometimes they're pushing and sometimes they're pulling. But to understand and to build the relationship so that you can be active in that consulting relationship, in that caregiver consultant relationship, right? I don't want to skip people's questions, but before I get to the next question, Patrina, you are absolutely right. It's so funny. Our last support group, we talked about siblings of people living with sickle cell disease, as well as the children of adults living with sickle cell disease and their experiences, and that they hold a wealth of knowledge, and that we have to create space for them to talk about what they went through, because it does. I love that you place an emphasis on the fact that sickle cell disease affects the whole family.
Oh, yes.
As we're talking about community, what can someone who may not be affected by sickle cell disease, what can they do to support the sickle cell community? And I'm just going to start by saying, donate blood. You said it.
Me too. I was going to say that. If you can donate blood. If you cannot donate blood, recruit blood donors at work, at church, or if you are in a position where you can open the door for the sickle cell patient or the caregiver, an advocate like Ray and I, to come and talk and educate people around you, do it. Recently, a friend of mine, we've been friends for over 15 years, and she called me, she said, well, I work in a special unit that investigates cops when they make a mistake in their work. So she said, and we came across a case, and I thought about calling you to come and talk to them. And the case was that a young sickle cell warrior was arrested for a reason that we are not going to, I don't know why. And he was arrested, and they took him. Within 24 hours, he was dead. He died because a sudden death. They don't know what happened. But when they took him to the station, they did ask him if he was taking any medication. He said yes, but the person did not register that. So they end up locking him up. So I believe what happened, what are the triggers, right? Stress.
That's right.
Cold, temperature, being in the same position for a long time. All that must have happened.
Crisis waiting to happen.
And we don't know which medication he was taking anyway. So he just collapsed on the floor. And by the time they got him, he was 22 when he passed away. So now the investigation is going on and everything. So, and she said, when we were talking about the case, yes, we talked to physicians and everything, but I said, let me bring the community perspective. Let me bring a caregiver to come and talk to you. When I had those cops, all of them here, and I was able to talk to them about the parent perspective. And I told them, I said, we understand that you have to do your job, but here is the thing I want you to know. If you have somebody in front of you and they said, I have sickle cell, they will need special accommodation. You cannot treat them as any other person, put them on in that car, in a position where they need to be hydrated. If they need the medication, you need to take, if they say they are in pain or something, you need to take them to the hospital within 30 minutes, because that's what the physician tells us. They need care when if they are, in a situation where they are in crisis, in full-blown crisis, they need care within 30 minutes. So I explained all that to them. And I said, and if you've seen them with any kind of medication and they don't have a prescription to justify it, it's because their disease requires that. And they have to live a normal life as any young adult, any teenager, and they cannot be around carrying all these documents on them every day. They can forget them. Sometimes I go out without my driver's license. And I realize when I'm back, oh my God, So I talk to them as a mom, just to explain to them that I want you to know what sickle cell is. And I showed them pictures of young adults. And I said, a couple of young adults, I said, can you point out here who has sickle cell? You can tell, because it's an invisible disease. So for that, and because I tell them of the way some kids are raised, because you know what is the most painful part? When parents tell me that, oh, I don't want even people to know that my child has sickle cell. I've had a mom tell me that my sisters don't know that my daughter has sickle cell. Because they live in Africa and I'm here, and I don't want them to know, because they're gonna laugh and they're gonna gossip. So imagine that child, if they find themselves in a situation where they have to say quickly, I have sickle cell, so people cannot help you. So I'm telling them that also they will not volunteer the information right away. So you're going to have to insist to say, do you have any condition that requires, specific special accommodation? So all that we were able to talk to them. So we have to do this kind of intervention so that we can help our warriors, because they're going to live a normal life as any, they can get in trouble or not.
Absolutely. And I'm really glad that you brought that up, because every institution needs to be educated and they need to understand. So whether that's the criminal justice institution, whether that's the education institution, but let's talk a little bit about, and I know this, we can talk forever. So I understand that for those of you who may have to go, Biba and I even went to Canada so we could talk even more. So, but let's talk a little bit about the healthcare community. This is the community that we would expect to be more empathetic, that we would expect to understand, that we would expect that we don't have to re-explain what they should already know. And yet, after years and years and years of advocacy, we're not going to stop, but we seem to be going around the same issues, the same mistreatment, undertreatment, no treatment, the same stigma around opioids. Of course, that got worse. I don't like to call it the opioid crisis. It's the overdose crisis. And we don't live in a world that seems to be able to show empathy to people who have conditions that are outside of what they consider normal.
Yes. This is a tough one, because I've been around so many good physicians in Canada who are not only physicians, they are also advocates just like us. Every time we call them to come, and talk to the community, they are really supportive. Every time I send an email to them to ask them, for guidance, for any information that they have, their knowledge, they will do it, right away. So, but with time, and when I compare what I've been through, in Africa, as I was explaining to you how physicians are also, they're busy, they don't really take the time to explain things, and we just treat them, we put them in the pedestal like this. So here is what I believe should be done. First of all, they have the training of the physician. I don't know how it is in America, but here we know that they go through sickle cell in maybe one course, and that's not enough.
It's the same.
So I think every nurse, every physician has to be well trained, about sickle cell disease. And that is part of our advocacy work that we do, that it has to be part of the curriculum for them. So that's one thing they have to know. one chapter in one day. Okay, somebody is saying one chapter in one day. There you go. So how can you learn about a disease that has so many complications, a chronic disease, a disease like this, in one chapter? So it's not possible. So that's one of the things that we have to make sure that it's included in the curriculum and then they go through it. That's one. The second thing, as a community also, that we have to do, I think there is racism in this. And because the community affected are majority Black, so we have an issue here. All the people treating us are not from the community. So there is this barrier that is sometimes cultural. It's difficult for them to consider us with all our circumstances. And there is this communication issue that happens between us and them. So I think having more people coming to the medical field and the sickle cell field specifically from the community will help us maybe get a better care. And the other thing is not only for the physician, for anybody dealing with our community, we have to be able to hold people accountable for if they do us wrong. And that has not been done.
Yes.
This is one of the things that I am really proud of. I've raised my son to stand up for himself when he's not receiving good care. Mm-hmm. You have so many horror stories in the community that you can hear that you will even lose sleep over them. But have you ever heard of one single one where the family or the warrior himself stood up and followed the process to file a complaint and go, follow up to get the best treatment? It happened to my son, and he stood up and he changed it for himself.
Yes.
And I told him, I said, you don't need to raise your voice. You don't need to you don't need to beat anybody, but be patient, be firm, and follow the process.
That's right.
Because it's your life and you have a very fragile life. So you can't let somebody play with that life. And I will support you.
And that's exactly because what we call advocacy, I've actually started using the term effective advocacy, right? Because, it is ineffective to not get what you need and then start cursing people out. Yes. and become loud. Now people, because just human nature, they can't hear you, right? They hear the noise, but they don't hear your heart anymore. Yes. Because now it has gone into an emotional space. And of course, you're in pain. Like this is not because we don't understand what you're going through in those moments, and you shouldn't have to be going through that. But the reality is that to be heard effectively, there's a way of communicating that works better on your behalf. Now, I also want to add, I know, just like you said, there are some incredible physicians out there. We were blessed. My son had an incredible physician that took wonderful care of him. And I had so many questions. I actually got hired by the hospital where my son got his care for 21 years. And I was a little surprised because I gave them the runaround. I asked so many questions that they were like, ma'am, just go to medical school. I needed to feel like if my son can't come to me to have some of his basic questions answered, I didn't feel like I was being the advocate I needed to be. And I needed him to know that I was knowledgeable about what was going on with him. Yes. Right. Yes. And so it was important to me. I had to ask those questions. I had to better understand the disease that no one in my community at the time was talking about. So advocacy doesn't stop. Advocacy is learning how to get your needs met in the moment, but also advocacy is ensuring that where you get your needs met, that they have proper understanding of what the needs of individuals living with sickle cell are. And there are ways to do that can be so much more effective than losing our cool in the moment. But I want it documented. I want to show that there's a pattern that's happening here. I want to give suggestions. If I think I've written I've worked with other people who have written complaints. And the one thing that I always ask them to do is include a solution. While you tell them about the problem that occurred, talk to them about also what would have been more helpful in this situation is, so that they understand that we are reasonable individuals who simply want humane treatment. This is humanity.
Yes.
Like you said, it doesn't matter if you're a teenager and you've done something wrong, or a young adult. Even if you are in a situation where you may not have made good other decisions, you still have the right to be treated medically.
Yes.
That's humanity.
And you know, I think somebody asked the question to say, for healthcare providers, what can they do to help the patient and the caregivers? One of the first things I tell them all the time is listen to them. These people have been living with the disease since they were born. When an adult who is 30 years old, or even not even 30, even at 16, 17, they can tell you what worked for them and what does not, even if you are the healthcare provider. And again, they also that they don't know the disease, right? Very well, because when you've only studied and you have a couple of patients who have sickle cell, and you have one who is over 30 telling you, this is my pain management protocol, and you say, no, we have to start you at the lower dose and will increase if, and in that meantime, that person, the pain is increasing and they end up staying longer than they should at the hospital because you didn't listen to them, because you are the physician and they're the patient. It doesn't work. Listen to them. I love then when the patient said that, you know, I've been living this for my whole life. I can tell you about this disease more than you've studied in one chapter. So listen to the patient and also to the caregivers. They know. I'm telling you, when my son walks into the house, I look at him and I know either he's in crisis, either it's something that is moderate, you know, why are you out? You need to be in bed, or when is your treatment? Like we now joke about this when he starts, you know, even the way he responds or he starts snapping. I asked him, I said, when is your next treatment? Because he's irritable, he's tired.
Oh, yes.
Right? So you can identify all that. But I remember so many times when I take him to the ER and he can't talk and I try to talk, they go, man, can you please let him talk? I'm like, I'm doing it because he can't do it now.
That's right.
I am his mom and I'm the patient advocate here. I'm not the mom. Listen to me. I'm going to give you the info and I will step back and let you do your work.
Yes, yes.
Because he is not, I don't want you to talk to him. He is trying just to manage the pain now.
Exactly.
So can you just listen to me?
Exactly.
So that's what we need to be. We need to be able to, they need to be able to listen to us, to work with us. And don't forget again, consider us with all our circumstances is different. Why? You know, when they talk about accommodation, special needs, right? They will take somebody and look at their needs and then, okay, how can we build a program that works for you? It has never been done for sickle cell. No, in no situation have I heard them say, okay, this person has sickle cell, this is their own reality, this is the family's reality, let's build a program that works for this specific patient or for the type of complication that they're having. They will tell you, I've been complaining for years about this, they didn't look at it, then finally they look at it, but it was too late because I have necrosis, I have this, you know, listen, they said, oh, it's just a sickle cell. Yeah, I have sickle cell trait and I've developed some conditions sometimes then, and I keep telling them, the minute I said, oh, I have sickle cell trait, they will just dismiss it, or it has nothing to do with your sickle cell trait. And I look at all the people who are my age, same life condition, and they are not developing anything. I'm like, it has to be, but because there is no research done about it, so they don't listen to us. So any healthcare provider who will sit and talk with us and listen to the patient and work with them to create the best treatment plan, that's a warrior doctor, that's a warrior nurse. That's the one we want in the community.
I think that's the difference between a good sickle cell doctor and a not so good one. If you are a medical provider, if you are in a clinic that provides care, even if you are running a sickle cell organization, if you're not talking to patients and caregivers and family, you're not doing it right.
Nope.
You're not doing it right, because you need to hear from the lived experience. We can read about sickle cell all we want, but until you are able to understand the lived experience, and that only comes from leaning in. It does not come from, trying to overtalk and trying to tell them what they need to know. It's great that doctors educate to a degree, but also listen to how they're feeling. Listen to their experiences. I put in the chat, join the Patient Advisory Council if your hospital has one, so that your voice can be heard, and that you can impact change. And it is imperative, learn how to tell your story, so that people understand it. When there's an opportunity to share, your local community-based organization typically has many opportunities to talk to different community members and different organizations. Tell them that you'd like to tell your story.
Yes,
it is important, and tell them, about all of the things you want to be able to do in life. Like, quality of life matters, and quality of life is not defined by the medical system. Even though they have a medical definition for quality of life, you have to talk to a person to know what quality of life means for them. What are their goals? When I worked in pediatrics, I asked, so what do you want to be when you grow up? If you're a child living with sickle cell disease, you might not ever think about being a grown-up with sickle cell disease.
Especially if you've been told that you are going to die. And
exactly. And so many have. And so many have. And so whether you're a caregiver or you're a person living with sickle cell disease, dream big. My motto is, I'm gonna shoot for the moon, because even if I miss, I'll be among the stars. I want to dream big. I want to prove to sickle cell that we can do this.
We can do this. I want to talk about something that you mentioned earlier about the physicians, right? When we were talking about, so how do we make sure that they talk to the patient and the caregivers? So because I go back, as I said, I go back often to Niger, and every time I go to the center and I talk to the parents. I just sit and they bring all the mamas and the parents and the young adults, and I share our story. And I talk about my son, how he was, in the same clinic, and now he's over 30, he's leaving. So I give them hope, right? So I say, but listen to your doctor, take your medication. So one of the things that they're struggling with is to get people to start taking hydroxyurea, because they're just starting it down there. And the physician said, well, the parent declined because of the cost, sometimes because it's too expensive for them, they can't afford it. And then also because they've heard that it's a chemo, so they don't want it. And they heard that maybe their kids will not be able to have kids. So there's so many stories. And you will not believe me how many parents I was able to convince just by sharing my story. When I sat there and I told them my son was on hydroxyurea for over 2 years, no crisis. That's how he went to school. He graduated. And then it stopped working. Now he's on blood. But I tell them the year story. And then, so now every year when I go, I have to come. The doctors want me to come, because when they listen to you, they do it because they want my lived experience. And they see the pictures. And my son also goes there and talks to them. And he tells them, when I start taking it, it was really hard. I had stomach ache. So I changed the time or how I take it. So he gives them all these tips that we leave, that the physician can prescribe. They can tell them how the drugs will work in 2 to 6 weeks. It's not going to make them take it. But them talking to somebody who has the same lived experience, it's totally different.
Because they focus on the risk, but when we talk about our lived experience, we're talking about the benefits.
The benefits, exactly. So the way we approach it is different. And also there is the trust issue. They trust us because they go, she's a mom like me. She's not going to tell me to do something that's bad for my child. When there is this trust issue, the mistrust between, the community and the healthcare providers. So I think it's important that we work as one. When I say collaboration, the collaboration is just us, as a community, but with all the allies, the healthcare providers, the policy makers. Nobody should be left out. Any other group that you can bring in your circle and work with them, you have to. Somebody asked how they can support, right? How they can help. So if you don't, and we have to say, this is Sickle Cell Awareness Month. Blood drives, blood drives, blood drives. Because no matter what you see online that somebody was cured from sickle cell through gene therapy, it's one patient out of how many millions? So it's not there yet, right? We don't have it available. And even the bone marrow transplant is only for 10%. So until then, for now, waiting for the cure, we have the blood and we have hydroxyurea. Those who are taking hydroxyurea are fine. Those who are not, they need blood. And we have the community. How come we don't have enough blood donors, Black blood donors?
That's right.
You know, just go and organize blood drive in your church, in your community center, take to your colleagues, become a blood donor yourself, and then commit. You know, I am in a group called Black Business Montreal, and I look into that group. There are about 50,000, I don't know how many people. And one day I was doing some math. I said, if each and every one here of us commit to give $5, not 10, not 20, $5 a month for 5 months, we were going to get the budget we were looking for to start our registry in Canada.
Yes.
Just to set up the registry.
When everyone gives a little, no one has to carry the burden of or so more than their. Yes.
Exactly. So support your local organization.
Yes.
If you can commit to a monthly donation of $10, $20, whatever you can give, or your yearly donation, when you're going to do it, give it to a group that is working for something.
That's right.
That's going to change the quality of life of people of your community. That's how all the community have been able to lift each other, you know, to support each other. So we don't have that, you know, we don't have this culture of donating our, will to an organization. We don't have all that. So we have to start somewhere. The young generation has to come. And I say to my kids, when you turn 18, there are a couple of things I want you to do. The minute they turn 18, you vote. You always vote and you donate blood.
That's right. Those
two things, you do them. Now they all have jobs. I said, you donate to the organization and you get your receipt, tax receipt. Right. So I'm teaching them to have this culture and then bring it also.
And I tell people, whether you have donated blood or not, if you donate one more time than you donated last year, you'll still be saving more lives, right? Exactly. So if you've never donated or you didn't donate last year, donate one time. If you donated twice last year, add one time to that, you know, and bring a friend. Bring a friend. But we in the sickle cell community are probably best positioned to help our community understand why their blood matters. Right? Yes. We can read all these articles. We can, you know, we have all kinds of blood donation organizations, you know, who are typically run by non-Black people trying to tell, you know, diverse populations why they should donate. We must take that responsibility. You know, it is a privilege to walk into a medical center and not have to worry about having blood available. It's a privilege. You come from a place where every time your son needed a transfusion, you had to find
the blood
donors, and they might not have been a great match.
Nope, you know? They might not. No, and then I had also sometimes to just explain to them what sickle cell is and why they have to donate the blood. So I had to work so hard to get them to come and donate. That's one pocket of blood that will save his life. Here we don't have to do it, but and again, that's when I said that we have to make the world sickle cells friendly, and it has to start. You know, it has to be done by us. And when we talk about by us, for us.
We're the us. I tell people, we the us, y'all. We the us.
Yes, by simple actions like that you can do. And then another thing that you can do, if there is a sickle cell warrior in your circle, even if it's a family member, if it's a colleague, if it's a friend, there is something I think it's important that support them in any way you can. It doesn't have to be financial, but you know what? Make plans with them, pick them up. Sometimes go do something very simple. There is this warrior here who lives in Canada. We are in contact, but you know what? Once a year, we go for a lunch. I don't see him after that, but I look forward and he looks forward to that one. He said, you know, my lunch with Miss Biba. So we go have this lunch. And he said to me that, you know, it's just something that I look forward every year. So we can't do it more often because I'm busy, he's busy, but we do it. So that's my thing for in his life. I said, I'm going to be that friend that goes, and we always talk on the phone. We pick a restaurant where we've never been, both of us. Sometimes we drive a long drive to go and sit, and we take time, we eat, we talk about everything, life, we laugh, we take a picture, and we said, okay, see you next year. And we do it around his birthday all the time, before or after, whenever he can. So this is a simple thing that, it's not my son. I don't bring my son along, but it's him and I. Simple thing that you can do. Just make a plan, support them, and see something that you can do sometimes for them when they can do it for themselves. It's really important. And we are a community, that we like to help each other, right? We like to be in each other's life. So it's something easy. You said, today I'm going to do my grocery. How can I help? Can I help you?
Yes. Can I buy a little extra? Yes. And I think this is a perfect time to say, you never know what someone's going through. So even caregivers, the same. I see a question about, self-care. When you pause your life to be there for someone else, not only is that fulfilling for you, but it interrupts sometimes really depressed feelings, sometimes that isolation, sometimes that feeling that no one understands. Those feelings those are very realistic feelings. And so when you get that surprise phone call, or that you have something important coming up, those are the reasons to keep going. That's the hope that you talked about, because there's plenty of things that try to steal your joy in this journey, but we have to replace them with the things that bring us joy. We have a program here called Sickle Smile, and it is our mental health initiative, right? And it's about finding the healthy things that make you smile and doing more of it. Because there's something about just simply finding a reason to smile that gives people a reason to live on. And so we have to do that. If you're a caregiver, whether it's once a month, once a quarter, find a time to do something for you. I didn't do that well when my son was small. I didn't understand the self-care. All I knew is I've got to be there 24/7, and I can still be there 24/7 and still take 2 hours out for yourself. And that's important. You can't pour from an empty cup.
Oh, no, you can't. And it's essential. It's essential for you to do it for yourself so that you can come back and then continue, with some renewed energy in your body and in your mind. So one of the things that is very helpful also is to work on yourself from the beginning. For new parents, they have the guilt issue there. So we don't talk about it from the beginning. So that's when you have to sit and say that it's a genetic disease. If you pass it to your child, it's because that gene was passed on to you. It comes from one generation to another. So there is nothing you can do about it. If you have some beautiful features that you love about yourself, can be your hair, your height, you don't complain about those. There are good and bad genes, and this is one of them. So it's not your fault. There's nothing to be guilty about. I remember, I don't think guilt was one of the feelings that I struggled with. For me, it was fear and sadness. I was sad. I was sad because he was in pain. I was sad because people said he might die, but I don't think I really focus on that, on the guilt part. If I had done that, I don't think I would have been able to have other kids. So for me, it wasn't an issue, because I understood that, it's just something that is in my blood that I gave my child, and the same way I gave him other things that were good, right?
Yes,
life.
Yeah.
Life.
And even when my son, I was not a person that struggled with the why me, and yet I know that that's a very real feeling. Yeah. And my son went through a very short phase of why me. And one of the things I said is, no matter how bad we think things are, there's always someone who has it worse, just like there's always someone who has it better. Yeah. And so, when we get into the why me, that's a form of comparing our life to someone else's, right? Our normal is not going to be someone else's normal. And so as a caregiver, I turned it into an opportunity to empower myself. Why not me? There must be something on the inside of me that can do this. I just have to find it. That was I kept saying, no, I know it's on the inside somewhere. I can do this. I can do this. Now, I'm not saying every day was rosy. I don't like when people give the testimonial and I just made it happen. Listen, some days was not a make it happen day.
Oh no.
Let's be
Some days
honest.
were really bad when you didn't know what to do. And
Absolutely.
how
But
you
I
do
had
it.
more days that I had to encourage myself in a positive direction, remind myself that I have the ability than the days that I felt like I didn't, because I made it a habit to say, this is our normal. It's not my neighbor's normal. It's not what my mom's normal was. It's not my other family members' normal, but it's my normal.
I know. I think I struggle with the why him more than why me, myself as a parent. And the reason why, because, we were taught, in life, how with our faith and everything, how God protects the weak, and the innocent and everything. And I look at this child, I'm like, so what has he done?
Yes.
Why him? So that was my question. And really for years, I was really struggling with that. And then when I start advocating, I think I find the answer when really I became an active advocate as a mom. At some point, I find the answer myself. I said, there is a reason why this child came into my life when I had no resources, no education. It's because he knew that I could be the mom that he needed. Exactly. And I have to stand up and be that mom. Exactly. I have to stand and be that mom. And then years and years and years, when we came to Canada, when he went to college and graduated, he's a pharmacy technician. So he decided to go back to Niger for his internship. So he went there in the same hospital where he was treated in the pharmacy ward. He did his internship and he decided to go visit the clinic where they were treating him. And the same head nurse was still there. She wasn't retired at the time. And he saw her and they chatted and he went through. He said, I couldn't remember all the places, but she took me around. And he said, at some point, I asked her about some of my friends that we used to come together for treatment. And she told to me, and she said, unfortunately, they are all gone. They are no longer here with us. And he came back and he was telling me the story. He said, oh, I went to remember this and that. Well, mom, unfortunately, they passed away and everything. As sad as the situation was, as shocked that I was, that was the first time that I stood and I said, okay, I've done something good. I've kept this child alive because I refused to give up. I did not believe that he was going to die. And I did everything in my power to seek the best treatment for him. So I saw the purpose. I said, then I have to continue to talk, to share my story, to tell other parents, don't lose hope. There are some hard times. He had surgery at 1. Look now, he's 10. So all that, I think it was the first time that I stood more firmly in my shoes as a warrior mom.
Yes. And when your child sees you be able to stand through it. Now, show your humanity to your kids so that they know you're not super mom, because our kids will often, they may not see that, it saddens us if we're trying to show how strong we are 24/7. I remember my son being in the hospital and I would go into the bathroom and I would sob because I didn't want him to see me crying while he's in pain. Like,
I cried.
Pain I'm feeling like that. I cannot show him that. But it was the sorrow of watching him in pain. So I would go cry, I would get it out, I would get it all together. And then when we would have conversations, we talked about his sickle cell even when he wasn't in crisis, so that he didn't feel ashamed of talking about it, right? So some of the stigma is because we don't talk about it openly, and we don't teach our kids how to talk about it openly. We don't teach our family how to talk about it openly. And it goes back to some of that guilt too, is I know that it was my genetic makeup, but I didn't know what I didn't know. I didn't know what I didn't know. Exactly. And so here we are, and we're going to make the best of it. One last thing, and then we're going to wrap up. And that is being a parent warrior with children. We have many families who are impacted that way. Mom or dad has sickle cell disease, and they have children that they also are responsible for. Some have partners that help them. Some are single parents. Being able, as we talked about, how do we support the sickle cell community? Being able to support them by, they might need someone to keep an eye on the kids, to watch the kids.
Yeah.
You know, I would love for the sickle cell community to create stronger networks of childcare, of transportation. When a parent is in the hospital, whether they have sickle cell or their child does, there might be other children left at home.
Yes.
You know, and we need to be able to identify ways that we can support them, because they'll actually get better. Their health will be better when they're not also worried about what's happening with the other kids.
It's true. Recently, I offered a young mom that she called me to say that her son was in the hospital, and she has a baby. And then she was at the hospital, and, you know, because he was young too. So I called her, I said, you know what? I'm not busy. I can come and spend the day, and you can go back and spend the day, and only come to spend the night with your child.
Yeah.
And she didn't really know me, and she did it. And you know what she told me? She said, I would have not even done this with my sister, but I've done it with you because I know you raised a child with sickle cell. So you will know what to do, what to say to my child. Yeah. And I think we spent a good day that day with that child, you know, because I knew exactly what to do. So that's the type of program that we can put together. Those who have time, those who can give those mother a little bit of, you know, respite time for them to go and do their nails, go and do their hair, and you stay with the sickle cell warrior. If he's in a mild crisis where he just needs somebody to be there, you have to create a network. But if they don't show up to your event, and if they are not on your mailing list, you can share the information with them. So that's when we need them to come to the village, join the community.
Exactly right. Come to the village, and you're just so right. And you know, that also means we need more day clinics. So infusion centers, because you brought up something really good. It might be that you have to go to the infusion center for 3 days in a row, but you can't stay at night because you have children at home. Yes. We need more day clinics that allow you to, what I don't understand is you might be in the hospital for a week, but if you go to the day clinic for too many days in a row, they look at you sideways. Yes. But if I was in the hospital, it wouldn't, you know, it's expected. It takes time to get over the hump of a crisis. So, you know, that's part of the empathy and understanding about, you know, what hospital systems can do. Have a day clinic, make sure that there is room for sickle cell patients, not just cancer patients, because so many of the infusion centers are not built with all conditions in mind. It's built with one condition in mind. One
condition in mind, exactly. And that's what I said, sickle cell is a forgotten disease. It's our role as a community to keep advocating so that we are added on each all these lists. And then the resources are allocated to sickle cell for the physician to be able to care for our community better than they are doing now. Yes. So having said that, it's on us again. We have to come together. We have to work together as one. So join your patient group. If you are in Minnesota, I'm telling you what my friend Ray is doing is exactly what has to be done, what we need in the community. What we're doing in Canada is also what I know that any caregiver will want to see. But we need you to come, join us, and we work together so that we can change things for ourselves. Because nobody's going to do it for us. Because that's what has been happening. We've been sitting and complaining and pointing the fingers for generations. I won't say years. I'm saying for generations. Oh, well, they don't do it for us because we're Black. Okay. Well, now let's work to change things for ourselves, and the whole world will follow.
I tell people all the time, nobody's coming to save us. Nobody's coming to save us. We have to begin to see how to build an infrastructure and a network amongst ourselves where we are saving each other.
And the resources are there. We can do it. We just have to work together.
Yes.
Unite and be stronger and work and change things for the better. Because
and can I just say, we have to not focus on our differences. We must focus on our shared experiences. all too often we get hung up on, well, you were born in this country, I was born in this country. We cannot allow that to be what divides
Sickle cell
us.
don't care.
Sickle cell don't
affect
care
you
what
the same way.
planet you were born on. It
Yes.
doesn't. It doesn't care what color your skin is, though it disproportionately affects Black and brown people.
Yes.
We have to link arms no matter where we are in the world, because we can create this network. We can create an infrastructure of support, and our voices together are so much more effective than our voices individually. So what a powerful way to wrap it up. This is my friend, y'all. You know, I have a lot of guests on SickleSMART, and I know lots of people, but I reserve the word friend for those who truly are a friend. And Miss Biba, I could hug my screen right now because I miss you, because I haven't seen you since the summer.
Me too.
But
thank you so much.
I'm so grateful. I want to remind people once again, I'm going to do my shared screen, that this session will be available tomorrow on our YouTube channel. You see that our YouTube is listed here along with our website. We have we have a couple more SickleSMART sessions coming up this month. We hope that you'll join us. Let me go to my next. I want to make sure, I did not change all my words. That's what happens when that should say Miss Biba Tinga, but the website and the social media are all correct. But thank you so much for speaking with us. Just a reminder, next Tuesday, September 6th, we'll be talking with Dr. Charlie Ware of Healing Blends, and he will talk to us about natural wellness and using God's medicine cabinet to optimize your health. And then next Thursday, so a week from today, we will also have Dominique Bojan. She is amazing, y'all. I met her earlier this year. We actually did a teaching session together with other nurses. She's going to speak on health disparities and inequities in sickle cell disease, and how they show up in different parts of the world as well. So be sure to join us. You see our Eventbrite channel down at the bottom. That's how you can see all of the sessions that we have coming up, and you can register. I always have a slide, because if you really want to lend a hand, go ahead and lend an arm. We encourage you to donate blood, find other people to donate blood, do it together, make it a day out. And then if you want to learn more about donating blood and why Black blood matters, we did a session a few months back about diversifying the blood donor pool, and you can see that on our YouTube channel as well. And then Be the Match. We didn't talk a lot about that, but Be the Match here, and I don't know the full situation of Be the Match and bone marrow transplant in Canada. But certainly if you have that option available, join the registry. Yes. Invite your friends and family. Again, for the same and similar reasons as donating blood, we need that ethnic similarity to ensure that it is a safer procedure. So we encourage you, if you're a person living with sickle cell disease or you are a medical provider, there is a free package available at sicklecellconnect.com, and you can get more information about Be the Match and about bone marrow transplant as well. Be sure, if you are a medical provider or you're in a position to share this with individuals who have sickle cell disease, please do that as well. We have our monthly activities. We will still have this month. We do a cooking class, because the amount of inflammatory foods that we put in our body does not help our health. So sometimes just learning other ways to cook things, other ingredients that we can use. And then of course, our sickle cell support group. It is the last Thursday of every month. It is open. It is open. It's not just for Minnesota. So we invite you to join us as well.
I will share it in Canada. Send me the flyers.
Yes.
And then,
Yes.
Yeah.
Because there's the village is here. The village is here. Yes. We waiting for you, but we gonna come get you whenever we can. So,
and you see what the COVID pandemic has turned, that there are no borders. We can work together wherever you are. So
that's right.
Let's do it.
For those in Minnesota, if you need school support, we now offer school support year round. With school supplies, we can assist with education planning, nurse education. And if you're struggling with purchasing school meals for your child, we can assist with that. And then it is Sickle Cell Awareness Month. And so every year we host our Sickle Celebration of Hope. It is a fundraising event so that we can continue to provide and meet the needs of the sickle cell community. So we invite you. Last but not least, again, no matter where you are, we want you to use your voice because your voice matters. We want you to tell your story, but we also want to hear about your medical experiences so that when people like Biba and myself are sitting at tables of influence, we are using real life experiences. We don't use your name. But we do talk about what went well, what didn't go so well, if there's a pattern at a particular institution. But we also want to know the good news. Do you have a doctor, a nurse practitioner, someone on your medical team who's doing a fabulous job, and you really want to make sure that they're recognized for the hard work? We want to hear those medical experiences too. So that's how we make a difference, using our voice. So we encourage you to continue to do the same. And once again, just last but not least, thank you again to our sponsors, Beam Therapeutics, Agios Children's, Be the Match. We are grateful that all of you are here. This was one of the best, and I'll tell you, Biba knows, this is one of many things that we're going to do together. Minnesota has a very large African population. We at Sickle Cell Foundation of Minnesota, we want to lean into that. We want to make sure that we don't take only our North American values and assign that to everyone. People have different backgrounds. They have different experiences. We want to embrace all of that. And we wanted you to know that there is room here for everyone. So please, we want you to join us. Any other questions? I don't see any more coming through. We've been here 2 hours. This is the longest any of our SickleSMART sessions has gone. So I want to once again thank Miss Biba Tinga, President of Sickle Cell Disease Association of Canada. I want to thank each and every one of you for coming, attending, staying, and being part of this conversation. This conversation is to be continued. Yes. All right, signing off. Thank you so much, everyone.
Thank you. Bye-bye.